Hello, everyone. I've got Derek Holycross here today, and we're going to talk about what it's like to be a pharmacy leader. Derek, you want to introduce yourself?
Sure. Well, hello, everybody. My name is Derek Holycross. I'm the Eastern Region Director of Pharmacy for OSF Healthcare. I have 6 hospitals of the 16 hospital health system now. I came from Presence Health previously when OSF acquired 2 of the Presence Health hospitals. I came over with them, and so I've been the regional director with them for coming up on 6 years, 5.5, 6 years. Prior to that, I was a pharmacy director and a manager within Presence Health, worked clinical staff pharmacy as well, worked in ICU and in the pharmacy and in hospital mainly, worked a little bit of retail pharmacy on the side as well. Became a pharmacist in 1997, but most of my career has been in hospital, and I've enjoyed it. That's kind of what I kind of found my niche back in the day.
So, what made you want to become a pharmacist?
Well, if I go way back in high school, I mean, from an academic standpoint, I enjoyed chemistry, enjoyed math, and the sciences, those sorts of things. But I really had an overwhelming want, desire, or if you will, to do something I felt like that mattered. Not that engineering or that sort of thing doesn't matter, but that really had an impact in people's lives. And I just wasn't making a product. So that's something that stuck with me throughout. I started pharmacy school 31 years ago, so I guess over 30 years now that I've tried not to. I've tried to remind myself of that you get to do something that's important to people, and so I've enjoyed it. I mean, my career path has shifted. It never really went the way I thought it would. Which if I have people listening to me that think that everything's going to work out, step A, step B, step C, most likely it doesn't go that way, but that's okay. It's good to be open and make sure that you're preparing yourself for the next step as best you can, and be ready so that when that opportunity does come, that you feel like it's a good fit, and maybe someone else feels like it's a good fit, that you're ready to go. So, no, I've just enjoyed pharmacy. I enjoy working with people. I enjoy, especially from a hospital standpoint, every day is a little bit different. You don't know what kind of patients you're going to be working with. You don't know what kind of situations you're going to be working with. It could be the busiest day you've ever had in your career. It could be a slow day. It could be, just a run of the mill day. And it could be, um, an experience that who knows? I mean, I've even been through, um, helping take care of church bombing patients. I mean, I never thought that day when I got up that I'd be taking care of, something that significant, but, it's just every day is different. So I've enjoyed pharmacy, and it's been a rewarding career for me and my family.
So, how did you end up getting into pharmacy leadership, and what was kind of that progression to that?
Okay. Well, like I kind of alluded to earlier, it was never really anything that I thought this is what I want to do someday. In fact, I really kind of shied away from management and leadership. I thought, too many headaches. Why would you want to deal with that? But it was about 4 years in to after I finally graduated. I did take some management courses, that electives in college, just to kind of round me out a little bit. I had some open slots, and those seemed like that they would be good investments in time and effort. So I did that. I'm glad I did. But at any rate, about 4 years in or so, there was a lot of transition. And it seems like throughout my career, about every 5 years, for whatever reason, the winds of change kind of blow. And, I won't say upheaval, that's probably a little too strong, but there's just transition. It's just kind of the way things happen organically, I guess. And so for me, about 4 years in, we had a pharmacy management company contract, and the hospitals that I was working for decided they wanted to end that contract. And so my director, who I reported to, was not going to stay on with the hospital. He decided to stay with the management company. And so when he left, it created a vacuum. I wasn't necessarily interested at first. He did encourage me to apply. I felt like he was crazy. I was only, 28 years old or whatever, and thought that was not for me. But so there's a couple of us that kind of filled in as an interim role, and the applicants that we were getting just weren't real strong. And as I kind of started doing things on an interim role, I thought I kind of like this. I kind of like the challenge, the you know, not necessarily being in charge, but just um, problem solving and trying to figure out solutions and working with people and kind of servant leadership was kind of how I felt, where I could be an advocate for the people that I had been working with, and they're going to continue to work with me. It's just I happen to have responsibility for the place. So about 6 months into that or so, I finally decided, why not? I'll throw my name in the hat. And so I did, and throughout those interviews, they were really, all the administrators were really encouraging to me, and I remember sitting down with the CEO at the time for my interview with him, and his first words were, "What took you so long? Because we know that this is what you need to be." Um, so that's kind of how I organically moved into that. I really enjoyed it. I did have a brief time where I stepped out of it, as my wife and I have 4 kids, and it was getting a little bit overwhelming at home at the time. And so I decided to step away for a few years and came back when times are a little bit easier to have more flexibility. And I don't regret that at all. I mean, it might have changed my career path a little bit. It's hard to say, but um, as I look back, I know that God had His hand on my career path, and I'm happy where I'm at now. And then, to kind of fast forward, as this opportunity came open with OSF when they acquired us, I never thought I'd really have the chance to expand to like a regional role without, relocating. But with OSF acquiring us, and that opportunity came about, and it's been a real good fit for me. I've enjoyed working with new people and working with the different sites and trying to achieve the results we need to achieve. So that's kind of where I've been. It's been more organic, if I had to describe it high level. Not so much, if I do this, I will achieve this, and it's just as things have come open, I've tried to be ready for those opportunities.
And what have you done to prepare yourself for that?
A lot of that is, I mean, a lot of it's not necessarily didactic. I've tried to be as intentional as I can when it comes to taking on new opportunities. Even within my role doesn't mean that you take on a new job title. I mean, I have in my time, I've even been like patient experience or patient satisfaction leader. I've taken on lots of med safety type of things. Even back in the day, I'll date myself when we had pre-printed paper order sets. They were just a mess, and it was up to the print shop to take care of those, non-clinical people. And so we had unapproved abbreviations we're slipping through, and wrong drug doses and just unsafe things. And so I just decided I'm going to take over this. So I did that with some help. So really, a lot of that I think is just not being afraid to say yes. And it's a fine line, I will say. You got to caution. You got to be willing to say no at times, which I learned early in my career. I need to do a better job at. I kind of stretched myself, and that's probably a big reason why I ended up stepping away from leadership for a few years, because I had just stretched myself so far that I didn't have enough to bring back home for my family. So I had to step away to kind of reset. Um, I've had lots of thoughts of pursuing an MBA or MHA, and I never quite pulled the trigger. I have a lot of excuses for that probably, but I do wish I had done that earlier in my career. I'm actually looking at it again now, but um, so really just taking advantage of the opportunities, learning from mentors, soaking up what I see people doing that I would like to be recognized as, or and there's also the flip side of that too, seeing other things people do some things that I think is not as effective. And so I learn both from people's mistakes and from their successes.
Yeah. So what are your current roles and responsibilities as the Eastern Region Director?
All right. Well, my current role it is a little bit hard to describe sometimes, but I do have responsibility for, like I say, for 6 of the hospitals, varying from, larger 200 plus bed hospitals down to 25 bed critical access hospitals. So that can be a little bit of a challenge because, they are completely different environments. Some days I'll go visit one or go visit 2 of them. So I'll go from, a large urban hospital to a rural hospital in Upper Michigan, which is, for me, I love that. I love the difference in the variety. I think that's why I chose hospital in the first place, hospital pharmacy. But um, basically, I'm kind of the conduit between the OSF ministry or the OSS system, the corporate, some people want to call it, to the hospitals. And so, both goes both ways. I've got responsibilities to make sure that policies and changes and formulary and that sort of thing is carried out at those individual facilities. But also, I'm expected to take feedback the other way. So, if something's just not working at one of our sites, I'm supposed to escalate that. It could be a policy, it could be some new process or hardware, or how we're handling this controlled substance situation or whatever. So that's part of it. Like I say, I mentioned policy and making sure that we're following policies. If there's any diversion investigations, I'm involved with those, and just again, just kind of oversight, making sure that sites stay plugged in. The sites I'm responsible for stay plugged in to OSF, and true to the mission, and not just kind of doing our own thing, I guess, if you will. So hope that makes some sense.
Yeah. What's the most rewarding part of your role?
Um, Boy, that's hard to say. I mean, if I parse out enjoying versus rewarding, I enjoy the people. I enjoy the different, like I say, the different roles, the different sites, the different cultures. I mean, I just have 6 hospitals, but all 6 of them are so different. So hospital pharmacy departments, that is, they're so different in how they interact, their strengths, maybe their opportunities, that sort of thing. What I um, get the most reward from is when I see development in those teams, those individual teams. I really love to see them grow. I love to see individuals within those teams do things that they didn't think they could. And I don't take credit for that. I might be a catalyst for that to kind of help push those things along, or remove barriers, or just simply get time for them to flourish in those roles. But to see them, I've had a pharmacist come to me and say, "This has been the best. Uh, this I'm in my best mode right now as a pharmacist than I've ever been in the 20 years I've been." And that's like, I kind of want to be like Rocky and stand on the hill and celebrate that, because I know I'm not responsible for it, but I know I had a little piece of it. And it's not just for me though. I'm happy for them. That they're being released to practice at the top of their license, and to make a difference, and to know that they go to work every day and make a difference, and not just you know churn out prescriptions, or check the box, and just do a job. So that's clearly the most rewarding thing for me, is just to see people kind of unlock their potential.
Go like the other direction. What's the most challenging part of your role?
Challenging. I think the first thing that comes to mind, there are definitely big benefits to being part of a health system, and there's also the downside. And I think probably the most challenging thing is, I like to see things move. I like to, we see a problem, I want to fix it, and we move on. But part of a health system is, there's a domino effect. So if we change something within our health system, with our health information system, or if we, um, want to make a shift, most likely it's going to impact other sites or other departments. Or, I mean, there are even sites that we help manage their health information system that they're not even part of OSF, but if we change something, it might change um, their operation. And so that's challenging to me, that we have to wait for those things to kind of be vetted out, and approvals and that sort of thing. I get it. I understand that's why they're there. Sometimes our frontline employees, or mission partners, as we call them, struggle with that. Like, hey, there's a problem. It needs fixed. This is Wednesday. Why can't it be fixed on Thursday? Um, when it might take 3, 4, 5 months to get things in place. Now, granted, if it's a real high risk safety issue, it's not going to take that long. But that's my biggest frustration, I would say, is just, and challenge, is just operating within the constraints of a large health system, and keeping the wheels moving. So
Yeah. I know you mentioned before that sometimes you've used mentors and stuff to help push you along in your career, and and,
Mhm.
develop you. How have you gone about finding those mentors? Is it just been more organic, or have you sought them out, like certain people?
A little bit of both. It's probably 60-40 organic versus seeking them out. Um, I've not necessarily been one to go up to, say a hospital president or a CFO or somebody and say, "Hey, will you mentor me?" I do have people that I work with that report to me that do take that mode. I mean, they're interested in advancing and moving forward, and so they've sought out executive mentorship. And it might sound hard to ask, but those people are usually always willing to offer their time. Succession planning is very big in any industry, but I think even more so in healthcare, especially in a nonprofit that is very faith-based and wants to make sure that we continue our our faith-based mission. But for me personally, it's usually, at least it has been, when I've seen something in somebody that I want to emulate. I'll observe them and I'll watch how they handle people and how people react to them. And I'll just kind of take mental notes. I've also, I've reported to individuals that are very strong, and I realize though that I'm not them. I have to realize that, okay, these are my strengths, these are my gifts, these are the things that I can bring to the table. I don't have that gift. But what do I have? Usually I have something else. Instead of focusing on the negative, I'll try to focus on what I can bring to the table. Um, so, probably more organic, but certainly I think it's important to seek those things out. I'm always looking for, these days we have access to so much through technology, lots of great leaders either in healthcare or outside of healthcare. And I try to go outside of healthcare some too, just because we get a little stagnant, always looking at the same thing. So I travel a lot. I'm in the car a lot for my work. And so it's pretty easy to find some good podcasts and check out what's going on. So
Speaking of podcasts, what are you listening to?
I like Craig Rochelle a lot. He's got a good leadership podcast as well as some of his faith-based stuff. That's probably the first thing that comes to mind. Yeah, just random leadership type things, maybe my boss or coworker suggests or whatever. So I'm not real good at always binge listening or binge watching certain things. So I kind of bounce around a little bit. So I get bored pretty quick. It's my ADD, I guess. So
I know you said you were looking at like possible MBA or MHA programs right now.
Mm.
Is it because you're looking at like expanding on your career and moving up later on, or just for your basic knowledge of those areas?
Much more the latter. I don't, I mean, I'll never say never, but I've always taken the mantra of when I've moved into a new role that um, I would be happy enough to do this for the rest of my career, and if not, I was going to move on to something else. I'm really happy with what I'm doing. I just felt like it's something that, can sharpen my skills, and, I've still got a good 12 to 15 years left of my career. Had 4 kids, so I can't be retiring too early. So uh, just more just to help me perform better in my current role. But as I said earlier, it's another way to kind of be prepared in case, who knows? I mean, we did have a vice president position open recently, and I chose not to pursue that, mainly more just for personal reasons. But I'll never say never. I mean, if it would open again, life might be different in 3, 4, 5 years, or who knows. So
Yeah. What piece of advice have you received from a mentor that's been the most impactful for you?
piece of advice most impactful. I think mostly just to stay positive. It's really easy in healthcare to kind of swirl the drain. Especially these last few years as we come through COVID, and public sentiment towards healthcare is kind of fragmented. and from a pharmacy standpoint, we deal with vaccines and that sort of thing, and just the crazy information that's kind of out there that, you know, you want to just kind of scream from the mountain tops that this is not right. If this drug works, and we would use it, especially if it's a cheap drug. Speaking of ivermectin and that sort of thing. So that's kind of can be kind of negative. Get you down, and you not enjoy, and you kind of lose the vision of what you're doing. So back to that. I mean, I think just staying positive and realizing what you're doing is still making a difference, and regardless of how tough times can get. I had a mentor years ago, tell me that, these times come and go. This is not always how it's going to be. Just keep working, just keep shoveling, just keep pushing, and the tide will turn, and it'll make you a better person because of it. But if you get negative, it's just really hard to get out of bed and go do a good work that next day, I guess. So other than that, take care of yourself, get plenty of sleep. I mean, I know that's easy to say, but you really do perform considerably better when you're well rested, and when you feel well. That goes for obviously any line of work. Those sorts of practical things, I guess, I think have kind of prodded me along to help get me where I'm at today. So
Yeah. Well, thanks, Derek. It was a pleasure talking with you, and glad you took the time out of your day to talk with me.
thanks, Brandon. Appreciated it, and
Yeah.
hopefully somebody can learn something from an old guy like me. So
Thanks, Derek.
all right, thank you. Take care.